Hi, I'm Alistair from Lazarus Training, and in this video we're going to look at how you might recognise if someone's had a stroke and what basic first aid treatment we can do to help them. In the UK, 100,000 people a year suffer a stroke. That's one about every 5 minutes across the year, so this shows why this is something that first aiders should be aware of. So when we talk about a stroke in first aid, we're talking about what medical staff would call a cerebral vascular accident, CVA. Cerebral stands for brain, vascular, blood supply, accident, well, stands for accident. So we know that there's an interruption in the blood supply to the brain. Now medical staff might dive deeper into this. They might say, well, was it caused by a blockage of the blood vessel? Was it caused by damage to the blood vessel? But for the people in the first aid world, everything gets put into this one bucket, strokes, because they're very, very common signs and symptoms. In a stroke, it's the brain that's under attack, and as the brain is our nerve centre, that is why we can see a variety of signs and symptoms. Now we might see things such as paralysis or weakness down one side of the body, but there's often more discrete things such as problems with the vision. So the person may develop double vision. They may develop sudden painless loss of vision in one eye, or that the eyes may not track together. We may see problems with the speech. Now the speech may be affected such as they cannot make any words, or they use inappropriate words, or they just make strange noises, but the speech can also be slurred. The person may get headaches, they may feel dizzy, there may be convulsions, they may lose control of bodily functions such as their ability to sit straight, to control their bladder, and we can in extreme cases see convulsions. Now because it is the nerve centre, obviously any function could be taken out and the person could potentially stop breathing. So what do we do if we believe that someone's having a stroke? Well, there are some basic first aid measures that we can do that will be really helpful. So first aiders are asked to remember a mnemonic called FAST. F-A-S-T. The F stands for face. We're looking for paralysis, drooping, weakness in one side of the person's face. A is for arms. We're looking for weakness, potentially paralysis, in one of the arms compared to the other. Ask them to raise their arms and look to see if they can raise them to the same level. S is speech. We're looking for things like that slurred speech mentioned earlier, or them using words that don't seem quite right. So if we see these symptoms, the T, it's time to call for an ambulance. This person needs to be in hospital quickly, getting the level of treatment that is beyond us pre-hospital. So we need to monitor them to see if and make sure they stay conscious. We need to be observing their breathing, but we also should treat them the way that you or I would wish to be treated in the situation. So treat them with dignity. If they have wet themselves, try and cover it up. Try and maintain their body temperature, try and maintain their body posture, and give them tons and tons of reassurance. For those of you that know how to do things like check a breathing rate and check a pulse rate, making a note of these would be useful for the paramedical staff when they arrive. But the key thing that you need to do is be there for the person, reassure them, and monitor them, so if they do go unconscious, you can go into the further first aid treatments. So in this video, we've looked at how we might recognise what a stroke is and what first aid treatment we should do. I hope you found the video useful in reminding you of the steps that you would need to go through. And if you've got any questions, queries or comments, then please do stick them in the comment section down below. Also, we've got more video content coming, so why not subscribe to our channel, hit the notification button to make sure that you get the latest information as it comes out. And if you have something that you really like us to cover as the video content, then why not send it through as a suggestion.